Okay, picture this. There's been a serious accident. It's chaotic, it's messy, and someone is really, really hurt. You see they're bleeding a lot, but you also realize they're not responding to you. In that split second, with all that pressure, you have to make a huge decision, and you have to make it fast. So what do you do first? Do you rush in to stop the bleeding, or do you start CPR right away? It's a terrifying question, right? And that confusion, it can make anyone freeze up. But knowing the answer ahead of time, well, that's the difference between being frozen and actually saving a life. So in this explainer, we're going to walk through the exact steps you need to take. We'll cover the classic first aider's dilemma, the one golden rule that guides every decision, the first checks you have to make, that critical moment of decision, a super simple analogy to help you remember it all, and finally, your power to act with confidence. You know, real-world emergencies are just about never neat and tidy. A bad fall, a car crash, these things can cause multiple, life-threatening injuries all at once, and that creates an incredibly tough situation for anyone trying to help. The real key to cutting through all that chaos is having a clear set of priorities. Just knowing what to do first gives you the confidence you need to get past that initial shock and take immediate, effective action. So how do you decide? Well, luckily you don't need to be a paramedic to figure this out. There's one simple rule that all the pros use to guide their actions in any complex emergency.
And here it is. This is the golden rule. Treat the biggest threat to life at that moment. It's not about trying to fix everything all at once. It's about spotting the single most urgent problem and dealing with that first.
Honestly, this one principle is the foundation for everything else we're about to cover. Think of it as your mental shortcut to making the right call when every single second counts. All right, so with that golden rule in our back pocket, where do we start? Well, before you even think about touching the injured person, you have to run through a crucial safety check. This isn't about treatment yet. It's about keeping yourself safe and getting professional help on the way. There are 3 basic steps. First, check for danger. Is there oncoming traffic, a fire, any electrical hazards? Your safety always comes first. If the scene is safe, then you check for a response. Shake their shoulders gently, shout loudly, "Are you okay?" And if you get nothing, you immediately send for help. Getting help on the way is absolutely non-negotiable. If someone else is there, point directly at them and tell them to call 000. If you're alone, call yourself but put your phone on speaker. That way, you can start first aid while talking to the operator. And trust me, they are trained to guide you through everything. Okay, so the scene is safe and help is on the way. Now you've arrived at the critical decision point, and it all boils down to one simple observation. Is the person breathing normally? Your answer to that one question determines your next most important action. So what does normal breathing even look like? Well, we're looking for regular, steady breaths. It is not the occasional gasp or snorting sound. That's a bad sign. You should be able to see their chest rise or hear or feel about 2 to 4 breaths in a 10-second period. And this is where the road forks into 2 very clear paths. If they are breathing normally, then that severe bleeding is the biggest immediate threat to their life. Your priority is to control it. But if they are not breathing normally, they are very likely in cardiac arrest. And in that case, starting CPR becomes the absolute #1, without a doubt, priority. Now, the signs of life-threatening bleeding are pretty hard to miss. We're talking about blood spurting from a wound, soaking through their clothes, or a large pool forming on the ground. Your action is simple and direct. Apply firm, direct, and constant pressure right on the wound. Use a bandage, a piece of clothing, even just your hand, whatever you've got. But if they're unresponsive and not breathing normally, that's the giant red flag for cardiac arrest. The action here is to begin CPR immediately. Push hard and fast in the center of the chest. You want to aim for about 100 to 120 compressions a minute. And remember, even if you only do chest compressions, hands-only CPR is still incredibly effective. I know, this can feel like a lot to remember, especially under pressure. So here's a really simple analogy that makes the medical logic behind all this stick in your mind. This just makes it so clear. Think of the heart as the body's pump and the blood vessels as the pipes. If the pump has stopped working, there's absolutely no point in trying to fix a leak in the pipes, right? Your first and only priority has to be getting that pump started again with CPR. Now, if the pump is working, but a pipe is leaking badly, then your job is to plug that leak. So really, it all comes down to this one memorable line that sums it all up. If the heart is pumping, stop the bleeding.
If the heart has stopped, start CPR. That's the entire decision-making process in a nutshell.
Now, even with that clear rule and the simple analogy, I know what some of you might be thinking. What if I'm not sure? What if I get it wrong? That fear of uncertainty is totally normal, and it's what we're going to tackle right now.
It's the question that runs through everybody's mind. In the heat of the moment, with everything going on, what happens if you just can't tell if they're breathing normally? What if you feel completely overwhelmed?
And the answer is your ultimate safety net. Call 000. Put your phone on speaker and just follow their instructions. You don't have to be perfect. You don't have to have all the answers. You just have to be willing to start, and they will be your guide. And that's really the core message here. First aid isn't about some kind of flawless performance. It's about having the clarity and the confidence to step in and do something when someone desperately needs help. This knowledge is what gives you that confidence.
So we end with this question, but now it's a question you're actually equipped to answer. With this clear framework, you have the power to turn a moment of sheer panic into a moment of action. In that critical situation, will you be the one who freezes, or will you be the one who acts?